Do I have your permission to share this video in my online DAT course, Corrective Techniques for Movement Dysfunction?
Yes.
Okay, so for assessment, starting off with upper body assessment, I really want to pay attention to his scapula. So for this, I would primarily pay attention to scapular winging and scapular rhythm. So in order to do that, have the patient standing upright, arms by his side, watching his scapular rhythm with my hands. So go ahead and raise your arms up and back down. Do that 2 more times for me. So just paying attention to the motion and the mobility of the scapula throughout ab and adduction, which in this case, do it a few more times for me, please. In this case, on his left side, he's got a little less motion than on his right. Okay, last one. And then for winging, I would have him place your arm behind your back, seeing how, do that one more time, go down and then back. Seeing how that wings out. Down, other side please. A lot less on this side. Do it again. You got it. Do it one more time. And on this side. Yeah, a lot less on that side. All right, so from there, we can start our progressions. I would primarily start with just trying to free up that motion that we saw within the assessment. So I would start with TheraBand pullbacks. We can do that in a variety of setups. So to really challenge that base of support, I would start him off standing, and then through the challenge with sitting on a medicine ball or a utilization of standing on either a Dynex pads or AirX pad. But for the purpose of this video, we'll start standing. Go ahead and grab your TheraBand. You can challenge the patient according to where they are within their rehab process, but challenge them with the color of band. In this case, I know that he's pretty strong, so he'll use a black band, but you can start off with any variety of band. So go ahead and pull all the way back. Really paying attention to his activation of his spinal stabilizers and his scapula stabilizers. You can palpate the activation there. Being sure that he pulls back so his scapula come together. I like to use the analogy of trying to pinch a pencil between their scapula to get that challenge. Do it 2 more times for me. Last one. Okay. And then from there we can progress to sitting on a medicine ball. Same concept, making sure he sits upright, activating those spinal stabilizers. Making sure he pinches all the way back. And we can even go further with a challenge of base of support by having him lift one of his legs. That will challenge that center of gravity and make his core work a little harder. You can see that he's having a little bit of hard time. Hopefully you guys can see this. He's having a little harder time of keeping that, keeping the ball from moving. Okay. Change legs. Give me 5. Okay, so from there we can work him a little bit harder in the quadruped position. I discussed this a little bit in a few of the threads from last week. And this kind of goes into a little bit of rotation as well, so I guess 2 weeks from now, but it's really good for pulling as well, so I'll utilize it for this week. So in a quadruped position, being sure that the patient maintains that neutral spine. You can utilize a baseball bat or a PVC pipe or something along those lines to have that activation, for the patient to feel that activation. But from here, taking the TheraBand and rotating, allowing it to pull them all the way down and then rotating out. Not allowing them to go more than shoulder height. There you go. All the while maintaining that neutral spine and activating that core. Give me 2 more. Keep your head in line. There you go. Give me 1 more like that. Good. Okay. So from there, we can even go further into assessing the lower body to be sure that that is adequate as well for the pulling technique. Go ahead and stand up for me. And just give me 5 double leg squats. Paying attention to making sure the knees don't go over the toes. He's sitting back in his hips. We can pay attention to the hip rotation and pelvic tilt. Stand on one leg. Just stand there for me. From here, making sure there's no Trendelenburg. Checking his PSIS. Opposite leg for me. Okay? And do a single leg squat. Good. Okay? So whatever we see kind of in that assessment, we can perfect through a few different types of progressions. For this video, I'll utilize rotational chop and kettlebell swings. So for rotational chop, beginning the patient in a kneeling position, double leg kneel, will kind of set them up for building from the bottom up, literally from the bottom up. So having them take it from across, from opposite shoulder down to opposite hip. Excuse me, sorry. Give me 5. Okay, we can progress to single leg kneel. So take one leg up. Continue. And we can challenge this even more, challenge the center of gravity even more through the use of a Dynadisc or AirX pad. You can build even more with standing. So have the patient double leg stand, single leg stand, and then again that utilization of either a Dynadisc pad, disc, or AirX pad. Okay. I'd like to use the TheraBand pads or Dynadiscs, whichever work best, and really activate that core through tandem stance with the use of the pads. I think that challenges the center of gravity and the core the most in combination with that upper body rotation and chop. Go ahead, 5 please. Which for this patient, I don't know if you guys can see this, but he's having his lower body here is really challenged, and there's a little bit of fatigue there. Okay, thank you. Last but certainly not least, we can utilize kettlebells, swings. if you don't have kettlebells, you can utilize dumbbells, just holding it at the top here. Go ahead and face the camera, please. So kettlebells are awesome because they challenge the whole body as a whole. In this case, making sure that the patient stabilizes the core. We can really work on that hip rotation and pelvic tilt, as well as maintaining the scapular stabilizers and the spinal stabilization through the use or through the activity of lifting the kettlebell up. Okay, thanks so much.